Welcome, everybody. I'm super excited to have you guys hear from Dana tonight. Dana has been with us for a while now, and her and I have chatted off screen a few times over the course of the last, I'm not sure, it's been a while now.
Yeah,
She's awesome. And one of the things that I love about this is being able to bring about some of the Western medicine and what we're doing together. So it kind of gives us a little bit more confidence in believing what we do. Plus, it gives us a really good idea of what people on the other side are doing. And her information is fantastic, and I love listening to you whenever you talk. So I'm excited to hear from you. I'm going to let you share your background and everything that you do, so I don't slaughter it. And so I will let you take it away.
All right, cool. Okay, so I can do screen share, right? Because I made a PowerPoint so that it forces me to stay on topic and prompts me so I don't forget. So what do I do? This bottom little box, right? And then desktop or not?
Yes. Wherever your PowerPoint is. Kenzie, you can help her the best.
Google Chrome, Photos, Preview, iTunes.
You can just say your desktop if you have it open already.
Okay, so my desktop.
Yep, and now we can see your Facebook.
And my pictures. Where'd I go? There it is. Okay, so we're gonna come here. Okay, is that right?
Perfect. Yep.
All right. Okay, so Romy asked me a couple of weeks ago to talk to you guys about how I incorporate oils into my practice. I'm an applied kinesiologist chiropractor. So it's different than just your typical adjusting. And I'll get to the details of that in a minute because it's pretty cool, but it's pretty detailed too. So my background is kind of not fun. I started out getting migraines when I was 3 years old, and I would have them chronically. My mom said probably every week or two, sometimes twice a week. And that continued for years. When I was in first grade, I started having chronic strep throat, which resulted in tonsillectomy and adenoids out and all that kind of stuff. And then in the summer after first grade, I had a vaccine reaction. And in and out of the ER and hospitals and doctor's visits. And some would say I had hepatitis, some would say I had mono, some would say I had chronic fatigue syndrome and lupus and fibromyalgia, but no two doctors ever agreed on the same diagnosis. So basically it was just a lot of exhaustion, muscle pain, joint pain. You know, the chronic migraines were continuing, no appetite, just very, very, very sick for a little kid, which was really troubling for my parents, obviously. I don't remember it very much that first round, but it recurred again. It kind of resolved itself after a couple of months. And then it occurred again towards the end of sixth grade and started getting all the same symptoms back. So once again, also during that time I was diagnosed with allergies. So ended up getting allergy shots and lots of those kinds of typical things that people would do. And nothing was really helping me get better. It was managing my allergies, but nothing was going away and getting better. I was never healthy. And then all of those same chronic issues came back in sixth grade, like I mentioned, and I missed the last 2 months of school, and symptoms continued into the summer. Again, started to resolve on its own, but same specialists, same confusion as to a diagnosis. They didn't have any medications they could give me because nobody agreed. So, I was just, one of those weird patients that no doctor wants to see because they don't know what to do with. So things continued again. And then I was doing okay until the fall of my sophomore year of high school. The day after I turned 16, it started again. I had all the chronic pain, and this time, this round, I remember clearly. The pain was just awful. it's hard, the exhaustion. I couldn't get out of bed for days at a time. I needed help getting to the shower and out of the shower. School was really difficult. Everybody thought I was making things up, and it was really, really hard trying to maintain friendships when you can't do anything with people and you're just a kid. So finally, after all those doctor's visits again, my family doctor said, she's probably just making up a lot of the stuff to get out of a class that she doesn't like speech or something like that, which I was in speech and I didn't like speech, but not enough to go through all of this. So they put me on Prozac, and my mom said that she literally would feel the life draining out of me. She said she saw me visibly get sicker as the days wore on. So she stopped giving it to me and finally scheduled an appointment with an applied kinesiologist chiropractor, who I went and saw after I made her reschedule it 3 different times because I was sick of seeing doctors. Didn't know what he was going to do. I'd never been to a chiropractor, hadn't even heard of what they did. And it was the most bizarre appointment of my life. It was the longest appointment of my life. It was a 2-hour visit. Applied kinesiology is not a quick go in, get adjusted, and be out in 5, maybe 10 minutes if you're lucky. Applied kinesiology focuses on the 5 factors of the intervertebral foramen of the spine, focuses on the acupuncture meridian, the neurolymphatic system, the neurovascular system. Nutrition is huge. And now I lost my 5th one. The 5 factors. Nervous system, just the nerves basically by themselves. There it is. So it's a lot of assessment. It's a lot of muscle tests. It's a lot of palpation, finding areas and points that that the doctor's touching and pushing and prodding to see what hurts, what feels good, and then having the patient involved with helping to determine what makes it better. So after that first visit, I started getting better. I was able to eat again. I hadn't been able to eat at all. And slowly my energy came back. It probably took 3-4 months before I could say I felt good, but each visit I continued to make progress. Life was super challenging for me as an adult. I ended up having to leave my high school because I missed a full semester and they weren't going to let me do summer school to make it up to graduate on time with my class. So I ended up being homeschooled, losing a lot of friendships with that. A lot of, all of that's traumatic for a kid, right? But it's okay. I had my horse, so I had my barn people, so that was all good. And then my AK chiropractor never really pushed for me to become a chiropractor, but he had it in the back of his mind. And I ended up getting pregnant my sophomore year of college. So that just kind of put the brakes on my education for a while. Had him, then I had a miscarriage, then I had my daughter. And then we got divorced because we never should have got married in the first place. And so after a little while, when my daughter was about 2, I kind of said, I had these 2 little kids, had my own place. I was working 2 jobs and I couldn't afford to keep my electricity on. I'm like, this is ridiculous. And talked to my doctor, 2 of them. There were 2 different doctors that I saw in that office, and both of them agreed that I should go to school for this. They said, you have the intuition, you have the knowledge, you have the experience as a patient, you'd be great, blah, 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 blah. So I applied. It all worked out. Moved to St. Louis, went to grad school.
Yay!
Hardest thing ever, going through that much school, being a mom with kids, living in a different state. My boyfriend was already living there. We ended up getting married just about 2 years after I moved down there. But yeah, all of those things are just, they're hard dynamics to work through when you're not going through grad school, right? So graduated, moved back to Michigan, and it was hard moving back. Harder moving back than it was leaving, and ended up going to work for my doctor, who changed my life and motivated me to do what I do. But working in his office was a horrible fit for me. By the time I started working there, I was the 7th doctor, and he had an 8th coming in as an intern, and it was just a very uncomfortable situation for me. I'm an empath, and I absorb a lot of the energy around me, and it was not good. Some of the other doctors had animosity towards me because I was like the favorite and nobody wanted to talk to me and nobody wanted to share information about patients. And it was hard. So left there and started an office out of my home. But again, that whole empath thing crept back in, and I was having problems maintaining myself because I was taking on my patients' problems physically. So I reached out to Alicia Brooks. I don't know how many of you know Alicia, but she and her husband were friends while I was going through grad school. Her husband, Travis, and I were in classes together. And she kept, not obnoxiously, but just kind of kept suggesting oils to me, but I never wanted to try them because of my allergies. I had so many scents and aromas that I responded to poorly. Now, knowing now, it's all because they were synthetic. But even when I first started with the oils, not frankincense, lavender drove me insane. I could not open a bottle of lavender. I could not open a blend with lavender. Now I can use it and it doesn't bother me, but I still don't love it. So had several people suggest them. I tried another company. One of my friends gave me her diffuser and gave me several oils because when I was taking boards, I was really sick. My baby was really sick. Oh yeah, I've got 2 extra kids too, by the way. After grad school, I had 2 more kids. So she gave me several of her company's oils and I used them and I was getting worse. So that put a bad taste in my mouth. Really didn't want to use them after that. But eventually I said, Alicia, okay, here's the deal. This is what's going on with my daughter with her allergies. This is what's going on with me with my emotions. And I started using them and it was phenomenal. Obviously you guys know, so I don't need to explain too much. But that's how I got started. One day how compliant do I have to be?
We keep them in the group.
Okay.
It's okay.
Okay. So I can say that I had a migraine.
Yes.
So I had a migraine and I was a little bit freaked out about using oils internally. But I had seen somebody say something about frankincense on the roof of the mouth. So I'm like, okay, I'll try it. So I did. And literally within 2 minutes, the migraine was 90% gone. And I was blown away. I'm like, okay, I'm a little bit sold on this internal stuff. And then too, I started thinking about it and I have other supplements that I carried before doTERRA, a couple different companies that are, they have extremely specific, for organ function and glandulars and things like that. And I was looking at those and I'm like, good grief, I've got Boswellia complex just in the herbal capsule form. So why wouldn't I want to use it in the oil form, especially since I had so many digestive issues that my body, when I would take supplements, I would end up with horrible stomach pain because my gut wasn't breaking them down. So I thought, let me try this frankincense internally instead of taking the capsule, since it's, the oil, it's super bioavailable. It absorbs and gets in the bloodstream. Let me try it. And it, you guys know, it's phenomenal. It works. It's great. So that's my story. Did that as fast as I could. Okay. So where to begin? The first thing that I talk about with every single patient is that what I do is a partnership with them. All the work that I do on them will help them by itself, but if they want the full benefits and the full effect, it has to become a lifestyle. They can come in and see me once a week. They can come in and see me every 6 months or 6 weeks or 3 months or whatever. I do give recommendations based on personal issues going on, but I'm not a chiropractor that says you have to come in once a week. You have to come in twice a week. It's completely based on wellness. But diet is huge. It really is. Cresta did a great job talking about gut health. So I don't want to reiterate that too much from what she said a couple weeks ago, but since it is so crucial, I am going to talk about it a bit. I recommend paleo diet. I'm not a big fan of vegetarian vegan stuff because there are amino acids and stuff in meat that are very helpful that we do need. But no dairy, no starches, sugars, maple syrup, honey, that kind, but no white sugars, no refined foods, all that kind of stuff. And really, when you're working with people, and you guys know this, work with everybody and, teach them the lifestyle and be their coach and their cheerleader. be somebody more to them than just, you know, somebody who's selling a product. Be somebody that genuinely cares and is there for them, and make a connection so that they want to come back to you. Another tip that I want to give you guys, that you can share with people. I don't care. This isn't something that I came up with, but it's to cold pack. Cold packing is super beneficial, and it's one tip that you can give to people that it's free information. It will help them, but you're not necessarily selling them something. So that's one thing that, you know, I especially have to work really hard as a doctor, that I, you know, because people are always just like, oh, you're trying to sell me stuff. You're just trying to make a buck off me and all that kind of stuff. So if I can give them some free tips and information to go along with that, it goes much further. So when I say, you know, give them, you know, make a couple specific dietary recommendations and then give them the cold pack instructions and say, okay, now I want you to add lemon to your water and, you know, digest them to your stomach, or put a drop under your tongue, or whatever, you know, that's just an example. You know, give them those other things first and then say, you know, but really you need to do this too. It goes further. Anyways, so cold packing is refrigerator temperature, not ice. Why, Trevor? Are you going to be my demo guy? No. Okay. You can go by yourself. Fridge temp. Ice is too cold because it's going to make the muscles constrict too tight to try and warm the area. And what you're trying to do is help the area to soothe and relax, because it's gut inflammation. So it goes right down here on the right side between the belly button and the right hip bone. You put the cold pack right here, directly on the skin. And then that's going to help to soothe and calm the ileocecal valve, which is where a huge portion of gut problems reside. So you put it on for 20 minutes, take it off for 20, back on for 20. During acute situations, do that 3 times a day. I saw somebody comment asking questions about whiplash. Whiplash, I would do this pattern as much as you can during the day. 20 on, 20 off, 20 on, 20 off, 20 on, 20 off. It's just going to help bring down the inflammation, even in the whiplash injury in the neck. When I have patients that call and say, you know, oh, I slept funny and I have a kink in my neck and I can't move my head, the main problem is not the kink. It is always tied to something in the gut when those acute situations happen. So I always tell them the cold pack before they come in. I usually don't adjust into severe inflammation like that unless I can just do a real gentle disc adjustment. But I do a ton of muscle work on those situations because it's just the body reacting from, you know, the gut not processing well. And that results in inflammation. And if there's a weakness, that's where a problem's going to happen. So it could be here. It could be low back pain. You know, it could be chest pain. It could be knee pain. It can refer anywhere. So how am I doing? Okay. So some things to know about the body. I'm going to go over these kind of quick. So if you guys want, I can post the PowerPoint. You want the PowerPoint posted in the group, so that way you guys don't have to like scramble writing notes or anything like that, because some of the slides just have too much information. But one thing that I want everybody to realize is that even if you're having pain in a certain area, it doesn't mean that that's where the problem is coming from. So the concept of referred pain is huge. And there's that's a lot to do with the muscle organ relationship. Every single muscle in the body has a relationship with an organ and its function. Every single tooth in the body has a relationship to an organ and its function. So if I see comments, you know, about toothache, and you can pull up, I have a picture in here, but I just literally Googled and said pictures of the tooth chart. And you can find the tooth and figure out which organ it's related to, and do oils, or supplements to help support that organ, because a lot of subclinical infections sit in the teeth and in the gums. So that's an important thing to remember too. Gut health, like I mentioned, every disease, even if it's just the common cold or all the way to abnormal cell function, everything begins at the cellular level. So obviously all the talk that we had at convention and everything else about cellular health is crucial. A little bit about inflammation. Fevers. I know a lot of people get scared of fevers. Fevers are helpful. A lot of you guys probably know that already. But fevers is the body's natural way of heating things up to kill a pathogen that's happening inside the body. So you don't necessarily want to fight them completely. You can manage them. You know, I mean, peppermint. My personal favorite is frankincense. I just roll frankincense across the forehead and on the back of the neck. That works really well for me and my kids. And then I'm going to talk a little bit about the neurolymphatic stuff too. So Trevor doesn't want to be my demo. He doesn't want to be on screen. Courtney wouldn't do it. I asked Adam to do it if he gets the kids to bed. So hopefully that'll work. But anyways, so this slide, I'm not going to talk about everything on here. But this is one that I wanted you guys to be able to see. So if you take a look, you know, I listed out all of the main organs and the muscles that relate to them, but you don't necessarily need to know the specific muscle, but just more kind of the area where it sits. But if you take a look at it, shoulder is brain, lungs, liver, thyroid, heart, and triple heater, which is kind of, triple warmer is kind of related to circulation, sex, and, you know, eyes, ears, some of that kind of stuff. So all of those things tied in. So in that respect, you know, you might want to pull up, you know, okay, where is this particular muscle and things like that to see which one might be more involved, unless you know your anatomy and you know where the muscles are. How I use this is with my muscle testing. So first I have this, I don't know if you can see it. Can you guys see that or not? Do I need to switch the screen?
We can see it a little.
Okay. I mean, you don't need the full detail on it, but this is called the temporosphenoidal line. So this is how I get started with my patients. All those little dots that are on there are nodules that run along the temporal sphenoidal line right up in here. And I palpate this to start my visits, find the nodules. The ones that are tender and painful are the ones that coordinate. I have a chart that tells me the muscles that are coordinated and the spinal levels that coordinate. And then from there, I go through and I muscle test those. And they'll test weak, they'll test strong, but I isolate each specific muscle. And from there, I also palpate the muscle. So I rub and massage at the origin and insertion of the muscle where it begins and ends. And if it's painful there, then that's one indicator that the muscle needs support. So then I go through in the neurolymphatics. Here's one of my neurolymphatic charts. So this one you won't be able to see. I can try and post this separate. I couldn't get it to scan and upload to put on here, but I'll try and do that. This is, I want you guys to have this charts kind of for yourself, but for your families too. You know, I mean, unless you're able to touch people because, you know, you're a massage therapist or something like that, you know, you really shouldn't be doing that. So let me see. Okay, I'll stand up and I'll try and demo on myself. So gut is huge, okay? So if you look, the large intestine, the small intestine is the thighs. So they're pretty easy muscle to test. So I'll test those, but then I'll check the lymphatic reflexes. And the large intestine, you just run your hand, and you guys can do this right now. Just run your hand with some pressure down the outside of your thigh, come towards the front and the inside. And if that's tender and painful, those are going to be indicators that the outside is large intestine, the inside is small intestine. So then from there, I go through and I have the patient touch other reflex points that relate to it. And if it changes that and takes the pain away, and if it strengthens the weak muscle and it takes away the muscle pain, then you know that that organ system needs support. Sometimes there's multiple organ systems that are in play. And from there, I just kind of have to go through and do lots of areas and assessment to figure out which one's the primary. But this is huge, you know. I mean, when you look here, so people that, you know, say, oh, I get all these cramps in the back of my thigh, I get all these, you know, and people that get Charlie horses in their calf, okay, look at the calf. Calf is adrenal, you guys. Adrenal dysfunction is huge. So people that are getting a lot of cramping in their calves with Charlie horses, you're going to want to look at the oils that support the adrenals. Okay. So, so it's not just necessarily a muscle issue. And it's not necessarily always a potassium thing. There's other things going on with that too. So, okay. So here's a tooth chart. I'm not a dentist, so I don't have this memorized. I just pull this up and look at it if I have, because I do work inside the mouth. I do muscle work in the gums and on the teeth, and it's extremely painful. People hate it, but they feel a lot better. I've eliminated back pain with it, only doing work inside the mouth. So it's extremely powerful. So, okay, like I mentioned, the pain isn't always the primary location. So, I mean, obviously there's exceptions to that. I mean, if you have an injury to it, things of that nature, but you're experiencing the pain where you feel it, but that doesn't mean it's a primary location, especially if you have bilateral pain. So when people are saying, I have plantar fasciitis in both of my feet, I have pain in both of my knees, I have carpal tunnel in both of my wrists, it's a central problem. It's either an issue, you know, with, you know, something in the cervical spine, for carpal tunnel. If it's both shoulders, it's cervical spine. If it's stuff going on in both feet, it could still be cervical spine. It could be lumbar. It could be your pelvis. But when it's both, you always think central, and you always look to gut because it's central. Okay. So knee pain. So if you go back to that muscle chart, knee pain is more often than not a gut and adrenal problem. So when you look at the knee, okay, you've got all of these, the large intestine muscles, the small intestine muscles, and the adrenal muscles all connect at the knee. The hamstrings connect at the knee, the quads connect at the knee, sartorius gracilis, those are hip flexors, and soleus gastroc, those are your calf muscles. So popliteus is gallbladder, so that's another digestive organ. So, you know, I mean, people think knee, you think you got to do stuff that's going to support the muscle. Also look at supporting the gut. Also look at supporting the adrenals. And like I mentioned, the feet is often, very often, gut or neck. So, so yeah, I mentioned the neurolymphatic stuff, so I can show you guys this chart and give you a copy of it. And the acupuncture meridian is another huge one. I don't know if any of you guys get acupuncture or know acupuncture, but that's one thing that I find quite often as well. And it's just kind of an indicator that I can work with. So, okay, I've got a couple questions for you guys. So if you want to unmute, if you know the answers to these, is it okay? And I expect you guys to know some of these. I do. Is it okay to go a few days between bowel movements? Nope. Should have 3 a day, ideally. And just, you know, I mean, you need to clean it out. And you need to have a lot of water to help flush that out. What fraction of the immune system lies in your gut? Does anybody know that one? Whoops. Ah, what did I do? Wow, I'm going the wrong way. There we go. Does anybody know what fraction of the immune system is in the gut?
80 to 85%.
Yep. Yep. What about the organ that provides the most digestive enzymes?
Gallbladder.
Nope.
Kidneys.
Nope.
Pancreas.
Pancreas. I heard somebody say it. The pancreas does. Yeah, so the pancreas has the enzymes for fats and protein and carbohydrates. So there's a lot that happens in the small intestine. What about the largest endocrine organ in the body? It's your gut. Where does digestion start?
Your mouth.
Your mouth.
It's not in your mouth.
The smell.
Smell, which goes to the brain. So digestion starts in the brain. So as soon as you smell food, see food, or think about food, your brain gets the process started for releasing enzymes and ghrelin and all that kind of stuff to begin digestion. What is the most common cause for ulcers and gastritis?
Stress.
Not necessarily.
Inflammation.
No.
Acid production?
Low stomach acid.
Low stomach acid. I heard it. It's low stomach acid. What is the third leading cause of death in the U.S.?
Accidents in hospitals.
Nope.
Isn't it liver failure?
Nope.
Not heart disease, is it?
Nope. Heart disease is number 1. Cancer is number 2. Number 3 is properly prescribed medical error. Surgery, medications, all of that is medical error. So that's why what we do is so important. That's why I'm so extremely excited about the Prime Meridian clinics. That was one of the things that I was probably most excited to learn about at convention, even though I wasn't there. Super excited about that. What is the cause of reflux?
Acid imbalance.
Yes,
But it has to do with the valve that doesn't close.
correct. The lower esophageal sphincter does not close because you have low acid. So you need acid in your stomach to signal the lower esophageal sphincter to shut, which keeps the food in your stomach to digest. So when you don't have enough acid, the food comes back up. It's because the valve doesn't close. So, just a couple facts, and Krista might have covered some of these too. But the GI tract is the largest and most vulnerable surface to the outside world. For most of its length, there's only a single layer of cells separating the external from the internal environments. So it's incredibly important to keep it healthy. It must simultaneously be accessible and permeable to nutrients and at the same time defend against pathogens and toxins. So we're expecting it to do a ton of work. You have different enzymes that are produced and released in different areas. Saliva in the mouth helps with absorption of nitrates from green leafy vegetables. And cardamom helps with lack of saliva. And that's become one of my favorites, actually. I put it in my tea every day now. So, okay, so I've mentioned HCl a couple of times. So I mentioned you need it for the lower esophageal sphincter to prevent reflux. There is HCl in the Terrazyme. There's not a lot, though. So it's great for enzymes. It's good for HCl, but if HCl is a concern, you're going to need to take a lot of the Terrazyme. So, you know, it's one of the things where when I compare the doTERRA supplements with my other supplements that I have, the doTERRA ones are great, but just know that as far as dosage, they're pretty low. So it's okay for people to need to take 2, 4, even 6 a day, depending on what they have going on. If they're not feeling good taking 2 twice a day, have them try taking another round. So HCl turns on the enzyme essential for digestion. It also kills pathogenic bacteria. It maintains proper bacteria in the large intestine, which prevents yeast and parasites from being problematic. Oils that help support the stomach are fennel, black pepper, cardamom, ginger, wild orange, grapefruit, peppermint, digestions, lemon sassy, aromatics, endocrine. You guys know a lot of these. I'm highlighting some of the oils in these categories in yellow. The ones that are highlighted in yellow, you're going to see repeatedly. So if you've got people that are on a budget and want something that's going to pack a lot of punch with just a little, just look for some of those. So a few more digestion facts. So like I mentioned, pancreas has the enzymes for fat, protein, and carbs, also hormones of insulin and glucagon for blood sugar. The liver is so incredibly important, you guys. Liver health is just so crucial. That ended up being, when I went in to see my AK chiropractor, he said that my liver was functioning at less than 50%, which is why I was so sick. So you can only go 6 hours without your liver before you die. But the liver is also the only organ that can regenerate itself. So don't worry if you have problems with your liver. And just because you have problems with your liver doesn't mean that you have, flat out cirrhosis of the liver. It just means that it might just need support. Absolutely everything that you eat, breathe, or put on your body has to get filtered through the liver. If there's too much crap that can't get filtered and sent to the large intestine to be excreted, it stays in your blood. If it stays in your blood for too long and doesn't get processed by the liver because the liver is overburdened, it reflects in skin rashes. So anytime you see a skin rash, think liver, whether it's eczema, whether it's hives, whether it's, a fever heat rash, whatever, you always think liver. Fever heat rash, I often see with kids after they've been sick and they've been given, we rotated Tylenol and Motrin. Well, yeah, you rotated Tylenol and Motrin, but they have the rash now because their liver is trying to process it, and their liver's so tiny, it can't handle that much. So that's why, it's really important for little kids to not have to take those kinds of things. That's why the stuff that we have is so good. So small intestine, I think I mentioned already that the largest amount of nutrient absorption happens here. And this is where much of the immune system lies, in the small intestine. And I mentioned the ileocecal valve for cold packing already. Large intestine has trillions of bacteria cells. Like I mentioned before, the HCl helps to protect the good bacteria from the bad bacteria. It helps to maintain that balance. And the large intestine is where you absorb most of the water and then form the stool. So, just kind of think of drinking water as, have you ever tried to flush the toilet without water? So just kind of a little tidbit. I don't know if you guys want me to go over the oils individually, but I just kind of listed them out. And the oils that I'm listing, you guys, I'm not a genius oil person. I've only been doing this for a year and a half. So the Essential Life book is my oil Bible. I reference that a ton. That's where I got most of this information. So, and again, these are just going to be the basic oils. There's going to be other combinations that you can use if you're looking for a specific issue. Why is it not wanting to go? Oh. Okay. Oregano oil. I wanted to talk about this because oregano oil is one that I've used even before I used doTERRA. I have had it in a tablet form, but it was pretty tricky because I couldn't get kids to take it because it's a massive horse pill and it was disgusting. So I couldn't get younger people to take it. And there are a lot of older people that wouldn't even take it because then they're like, well, I'm burping up oregano and it's gross and blah, 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 blah. So I love this oil very much. So oregano oil is a strong antimicrobial, stimulates digestion, and it's effective for relieving intestinal gas and killing parasites. It's got growth inhibitory activity with pathogens such as Candida, which is an issue I'm dealing with right now in my gut. I love GX Assist because it has oregano in it, as well as the melaleuca and lemon. So my personal use, and if patients ask me what to do if they don't want to take an antibiotic, I tell them 10 days of oregano 3 times a day, and then end that and follow it up with a PB Assist. I treat oregano like an antibiotic. I don't use it every day. I try and save it for when I need something extra. And when I do my everyday, I change it up. Right now I'm doing a capsule every day of the pink pepper, the yarrow palm, turmeric, and rosemary is my everyday capsule right now. But I'll change it up again in another week or two, and I'll do like frankincense and copaiba, and I'm just looking, what else will I put in there? I'll probably do Melissa. I don't do On Garden capsules because I add it to tea and I drink that every day. I put Digestion under my tongue every day. I had issues this morning because I forgot to do it first thing, and I went to my Bible study and like my nose was draining the whole time and I couldn't figure out why. I hadn't done my Digestion. Came home, did it, sinuses dried up. I was fine. So okay, that was a tangent. Sorry, Mark, I promise. I really didn't mean to do tangents. Okay, so if the gut's functioning and well, everything else will follow. But there are times that I need to look to how can I support the rest of the body. So there's gonna be times that the other areas of the body need support. One of the things that is my niche with AK is hunting down and finding subclinical infections in organs. So it freaks patients out because as soon as I mention kidney or liver or spleen, they freak out and think they have kidney disease or cirrhosis of the liver. If I say gallbladder, do I have gallstones? I'm like, I'm just saying it's not functioning well and it needs support. you know, and sometimes, yeah, maybe they do have something more serious going on, but I'm also not afraid of the more serious, because I have so much experience as a patient and I have so much experience as a doctor that I know this stuff helps if you let it. One little story, sorry, Mark, one little story. How much time do I have? Oh, geez. Okay. When I was going through grad school, part 1 boards, I got an ear infection. I have never had an ear infection in my entire life. My eardrum ruptured. You guys, ear infections are, from what my understanding is, are so much more painful as an adult than as a kid. And I could not believe the pain. It was way worse than childbirth. And I've had 4 natural labors. I had 2 at home, 2 at the hospital, no medications. And this ear pain was horrible. And all of my teachers just looked at me and they were in shock. All of my chiropractic teachers at school were telling me to go take antibiotics. And it was still, oh, there's my neighbor, Stacy. She knows this. She remembers when I had my
I remember this story.
Yeah, you know this story. You saw how sick I was.
And your little migraines with your chicken noodle soup. I miss you.
Oh, goodness. Okay. So, so this ear infection, I was going to my chiropractor and getting adjusted every day. I was getting IV nutrition. I would have a hot pack on it, sitting in class, listening to my teachers. I took pillows with me so I could lay down in class. And my teachers just looked at me. They're like, why are you here? I'm like, because I can't skip. If I skip, I won't get credit for being here. If I don't get credit for being here, I can't pass the class. So I'm here. And they're like, you've got boards coming up. Are you on antibiotics? I'm like, nope, not taking antibiotics. I haven't done it for years. I don't know how my body's going to react. And I don't want to have a reaction right before boards. They thought I was absolutely insane. They were all trying to convince me that I was going to get mastoiditis, which if you don't know what that is, that's horrible. It's when the infection goes into the mastoid bone of the skull. That did not happen. I did the IV nutrition. Didn't know about oils at the time. This was what, 9 years ago, Stace? 8 years ago? Long time ago. And yeah, it was, I ended up being fine. I fell asleep during one of my boards because I was so tired. And that was the one I did the best on because I was so relaxed. It was pretty crazy. So anyways, I know this stuff can work if you trust that it will and if you let it. But it's not just the oils. If you're doing the oils and you're still eating fast food and eating junk and having dessert and drinking soda, there's a lot to it. You know, the oils aren't going to take care of everything if you're not doing your part with the rest of it. So, okay. Okay. So I'm not going to read this to you guys. If you have the Oil Life book, you already have all this information. If you don't have the Oil Life book, I'm going to post this slide so you can see it. But this is kind of a chart that I use as a quick go-to when I'm checking people for stuff and I find a system, an organ system that needs support specifically, then I look to this. If I know that they have a subclinical infection going on with it, I look, okay, what do I use for subclinical infection? Which oils listed here? But the other beautiful thing with what I do is I can muscle test for it. So I have them hold the bottle of oil by their nose. I check those painful points. I check the muscle tenderness at the origin and insertion. If it eliminates those muscle painful points, then that's the correct oil for them. If it doesn't change the tenderness, then you don't need that oil. So that's just kind of one way to do it without the, what's it called, the Zytoscan. Basically what I do with my muscle testing is its own Zytoscan. So I don't have one because I have my other treatment ways of checking for stuff.
Can I ask you something?
Real quick.
Can you speak to the pills you used to use versus the oils?
Yes. Oh, did I do that? How did I do that?
Yeah. You used to put the pills under my tongue and then.
Oh,
like,
yeah.
Can you speak to that?
Yep. So I do that with the supplements too. I test the supplements. I put them on the tongue and I have people, you know, I'll muscle test if it strengthens a weak muscle and if it eliminates those painful neurolymphatic reflexes, if it eliminates the pain at the origin insertion, then that's the right supplement. So, yeah, so that's kind of how I do it. So I do it lingually for supplements. I have them taste it because as soon as it touches the tongue, it goes straight to the brain. The brain knows if it's good or if it's bad. That's why you have a gag reflex for bad food that's bad for you, so you spit it out. Same thing with your olfactory sense. It goes directly to the brain as soon as it hits the brain knows if it's good for you or not good for you and if it's going to help or not. So that's kind of how that all works. Another slide, this is just additional glandular support. You know, depending on what people have going on. You'll see geranium, frankincense, sandalwood, helichrysum are some of the biggest ones. Cardamom's another really big one. Rosemary is another really big one. I didn't get pink pepper added into here. Yarrow is on here because it was already in the book, but I also didn't get pink pepper or turmeric. Huh, that's a huge one. I love that one. So, okay, how much time do I have? Okay, quick word about cellular health. This has been a huge one for me personally lately because I've had so many people around me being diagnosed. But again, it doesn't scare me. And I don't know, maybe that's conceited or whatever. But I'm going to read to you out of my AK textbook their definition and philosophy on what abnormal cell function is. The basic purpose of the autoimmune system is to recognize and clear foreign substances from the body. Some consider abnormal cellular function an autoimmune disease in which the body fails to distinguish immature cancer cells from healthy body cells. Ideal autoimmune function should be able to destroy the cancer cells and maintain homeostasis. So when you think about it that way, I mean, to me, that makes perfect sense. Something's happening in the body and the body doesn't know how to respond to it. So there's foreign stuff that's happening, and I'm not going to blame it on just one thing. There's toxins coming in from everywhere. You know, it's environmental. It's what we put on our bodies. It's what we put in our bodies. You know, I mean, just the food we eat, the medicine, you know, everything affects the body, and a lot of it is foreign. So, so that's just kind of, that's my thing. So autoimmune issues run the spectrum, right? You either have too low of a response to a pathogen, or you have an inability to distinguish between what should be there and what shouldn't be there. So a few oils for the cellular support. I did add the pink pepper and the turmeric in here, and I forgot to highlight these, but the sandalwood, frankincense, lemongrass, wild orange, cinnamon, patchouli, yarrow, clove, thyme, arborvitae, turmeric. So when you think back to my success story and what happened to me when I started seeing my AK chiropractor, I have never been on a medication since I was 16 years old. Basically what I had and still technically have is an autoimmune disease. I will start feeling those symptoms again if I don't maintain a healthy diet. Those issues are always there reminding me if I'm not careful enough. I have 4 kids, all of whom I've raised completely naturally. None of them have had an antibiotic. None of them have had medications. None of them are vaccinated. My oldest, who will be 18 in December, has had 3 fevers his entire life. And he's had the stomach flu where he threw up 4 times. He's been sick with colds more during his high school years than he has his entire life before that combined, because he's with his friends and, you know, oh, well, I like regular milk now, and oh, chocolate milk's really good, and I really like this candy, and oh, I'm gonna eat pizza every day. And, you know, I mean, eating all these things that I technically deprived him of because he's told me that so many times. And it's possible, you know, I mean, I know you can do it with the oils. I've done it with supplements, and the oils are just that much more bioavailable because, like I said, they get in the bloodstream so quickly. Not that you can't use medications. There is a time and a place, you know, I mean, things get too extreme. I'm not saying that you can't do it, that you shouldn't ever do it. There are certain conditions that do need some support. Type 1 diabetes, I'm still trying to, you know, have conversations with another fellow chiropractor who is a type 1 diabetic. So he does experiment with stuff to see if he can do stuff to get off of his meds, but he hasn't figured it out yet. So unless he figures something out, I'm sticking with stand meds for that. So anyways, inflammation is necessary to get healing to an area that's injured and to eliminate it with the lymphatics. The adrenals are huge in playing a part in excessive inflammation. If the adrenals are too taxed and too stressed, there's not going to be a correct balance between those glucocorticoids and the mineral corticoids. So I've kind of got the breakdown of the flow chart of how that all goes down there. Stress leads to increased cortisol, which leads to poor gut mucosa, therefore leaky gut and dysbiosis, decreases your liver's ability to detox, breaks down steroids, which therefore increases your cortisol, and it's just a vicious cycle. So so stress is a huge factor in inflammation also. So okay, so I'm about done, guys. So this is one of my favorite verses in the Bible, Ezekiel 47:12. Fruit trees of all kinds will grow on both banks of the river. Their leaves will not wither, nor will their fruit fail. Every month they will bear fruit because the water from the sanctuary flows to them. Their fruit will serve for food and their leaves for healing. That's one of my favorites. Just knowing that everything was put on earth intended to be food and healing for us. I mean, that's so incredibly powerful when you just stop and think about it, because, Jeremiah 29:11, God says he knows the plans for us. He knows what's going to happen to us in our life, and he gave us what we need. So that's why my job is to encourage people to try natural first. And I know that, there's a point that, yeah, okay, if I'm not helping you enough, then yeah, let's go this other route. But more often than not, I haven't had to send people out unless they've got so much joint damage that they do need surgery. Otherwise, pretty good at getting people better. So I did, based on that verse and a Bible study that I did this winter, I did write an entire oil class, how to oil your armor, based on Ephesians 6:10 through 19. So if any of you guys would be interested in hearing that sometime, I'd be happy to teach that as well. Just kind of breaks down each piece of physical armor and associating it with the part of the body that it's intended to protect. So I kind of go over a little bit of information about it, anatomy, and the physical, but also the emotional aspect that goes along with it, and then tying in how to care for the body with oils and food and nature. So yeah, if that's something you guys would be interested in, I would be happy to teach that sometime. But yeah, so feel free to send me a Facebook message. I kind of go crazy in my group sometimes. If you guys want to ever follow me on there, you're more than welcome to. But yeah, thanks for letting me share with you guys. And yeah, I know it was a ton of information, so that's why I'll share the PowerPoint. And yeah, thanks, Romy.
That was fantastic.
How did I do on time, Mark?
Great. Awesome. Perfect.
So if you stop sharing, then we'll be able to see everybody again.
Oh, okay, hang on. How do I do that?
At the very top of
Stop
your
share.
screen.
There it is.
Yeah,
There we go.
Okay.
Awesome.
Okay.
That was fantastic. I read Courtney's message about geeking out. But I am not a science person, and this was perfect for me. It was very, very good. I loved it.
Good. So, I don't know. I mean, if you guys have any quick questions, I can do that. Otherwise, if you want to wrap it up, since it is 11, that's fine too. So, I'll leave that up to you guys.
We'll wrap it up and stop the recording, and then we can do after the.
Cool.
So if you stop the